Hi, I'm Rich. I'm one of the F1 doctors.
Oh, hi, I'm Maddie, one of the nurses. This is Anika. I'm quite worried about her, so I've called you. She's 61 and she's complaining of some pain and she just doesn't look very well. I've just done her obs and she's scoring an 8. Can you review her, please?
Yeah, no problem at all. Hi, Anika. I'm Rich. I'm one of the doctors.
Hello.
How are you?
I'm not too well, Doctor.
You don't look particularly well. What's going on?
Oh, it's just some pain really round in my back.
Okay. We're going to check things over. Do a bit of a top to toe and try and get you feeling better. Is that all right?
Yeah, that's great.
Okay, great. Yeah, she doesn't look very well, does she? I think she is talking, so I'm happy with her airway, but I think if we can pop on 15 litres non-rebreathe oxygen,
Yeah,
that would
sure.
be great. Is that all right? Thank you. Anika, I'm just going to assess your breathing. I'm going to check your chest. Is that all right?
Yeah, of course.
Do you mind if I pop your gown down, just expose you a little, just to have a look? Is that okay?
That's fine.
Thank you very much. Just pop that down. So, just having a look. I can see that her chest is expanding equally both sides. Maddie, when you've got oxygen on, could you please put a SATS probe on and count her respiratory rate for me?
Sure.
Thank you. I'm just going to have a listen into your chest, Anika, okay? So chest sounds quite clear. Just going to have a tap on your chest. Excuse me there. That sounds quite resonant. Equally bilaterally.
Her rest rate is 24 and SATs are 97% on the 15 litres.
Okay, great. So I'm quite happy with the B, with her breathing. So I'm going to move on to C, to circulation. Could you please pop a blood pressure cuff on and count her pulse rate for me?
Yeah,
Is that
sure.
okay? How are you? Gosh, your hands feel quite cold actually.
Oh, it's a bit cold.
They feel quite cold. In fact, you're only really warming up towards your elbows there. I'm just going to pop this down a little and put my finger on your chest there. 1, 2, 3, 4, 5. 1, 2, 3, 4 seconds. So her capillary refill time is prolonged and she is quite cool peripherally.
Her heart rate is 113.
Right.
Blood pressure's just coming through now.
Okay, so she's certainly tachycardic, she's peripherally shut down, and you can see that she's hypotensive as well. Blood pressure's 85/45. So she's certainly, this is all consistent with hypovolemia. Does she have a cannula in?
No, I don't think she does yet.
Okay. Would you mind getting IV access and taking some bloods? If we can just fill up all the blood bottles, including some blood cultures and a VBG.
Yeah.
I'll decide what to order later. And then I think we'll give a fluid bolus, 500 mils of normal saline. We can just run that through stat. Is that all right?
That's fine.
Okay, brilliant. So that's A, B, C. I'm quite happy with that. We've got an intervention that's happening there. So I'm going to move on. Nika, do you know where we are at the minute?
Yeah, we're in the hospital.
We are indeed. And do you remember who I am, what my job is?
Yeah, you're the doctor.
I am indeed. Great. So she's alert and orientated, so GCS of 15. I'm going to check your pupils. I'm just going to grab a torch and just shine a light in your eye there for a second. I'm just going to have to slip your glasses up. And lovely. So pupils are equal and reactive to light. Pop your glasses back down there for you.
I've done the bloods, including blood cultures, and got the fluids running.
Fantastic. Okay, Maddie, so I'd like to know her blood sugar before I move on from D. Is that VBG back?
I'm just going to get it now.
Thank you, because that BM should be on there. So A, B, C, D.
So the blood sugar's 8.5.
8.5, okay, great. I'm going to move on to E. Could you please check a temperature for me? Is that all right?
Sure.
And Anika, I'm going to lie you down a bit flatter and just have a feel of your tummy. Is that all right?
Yes, that's fine.
Just rest you down there. Just going to uncover your tummy there for a sec.
Temperature's 38.4.
38.4, okay, so high temperature. You let me know if it's sore when I'm feeling around.
Not so much over there.
Okay.
So get a bit more sore.
Around the side
Yeah,
there.
that's quite painful.
Is it? How about round the back there?
Oh, yeah, that's really sore.
Gosh, okay. And on the other side?
No, not so much there.
Okay. Have you had any urinary symptoms? Any burning or stinging when you've been going?
Yeah, actually, the last couple of days it has been a bit sore.
Right, okay. I'm just going to have a look at your legs. Just pull your blanket up there. Just having a look for any rashes, any swelling. There's nothing to see there. Okay, just sit you back up a little bit. So, I think what's going on is that you've got an infection, and the infection is what's making you feel quite unwell. It's dropped your blood pressure, unfortunately, which I think is why you're feeling pretty unwell. We're giving you some fluids, we're going to give you some antibiotics and take good care of you, get you feeling better soon, all right?
Yes, that's fine.
Okay, Nika. So Maddie, I think just in summary then, I think my assessment is consistent with hypovolemic shock, likely secondary to sepsis. I think we need to cover for sepsis with some antibiotics. I'm going to check the hospital guidelines to guide that. Her oxygenation I'm quite happy with, so I think we can down titrate her oxygen, aiming for sats of 94 to 98%. Could you get the sepsis bundle sort of halfway out and ready for me? And I'm going to have a chat to my registrar and just escalate the situation.
Sure.
Is that okay?
Yeah.
Thank you very much. Hi, can you put me through to the med reg, please?
Yes, popping you through now.
Thanks.
Yeah, hi, Medbridge.
Hi, it's Rich. I'm one of the F1 doctors calling from AMU. I've just seen a lady called Anika, who's a 61-year-old lady with septic shock, and I suspect that's secondary to pyelonephritis.
Right.
She has come in, she's got a couple of days history of some urinary symptoms, dysuria, and she's presented today with some right renal angle pain.
Mm-hmm.
On assessment, she's hypotensive, her blood pressure is 85/45, tachycardic 115, she's pyrexial to 38.4, and she's got a prolonged central capillary refill time of 4 seconds. I have put her on oxygen, I've got IV access and given her fluid bolus and antibiotics, TAS and Gent as per the hospital guidelines. I'm quite worried about her, and I'd like you to come and see her as soon as you can, if that's okay.
Yeah, sounds reasonable. And what's her tummy like?
Oh, she's got, so her tummy is soft, it's not peritonitic, but she's really severely tender in her right renal angle.
Right, okay, that's the button. Okay, fine.
Yeah.
I'll come and see you in a bit, about 10-15 minutes or so.
Okay, thank you very much.
No problem.
Thanks, bye.